As you all know, my name is Alex Oni Edigin. You were sent a video on mental health assessments by a registered mental health nurse. That was kind of qualitative picture of what you will see in a real mental health home or mental health hospital when we talk about assessing people, individual. This can actually happen in prison. It can happen in a normal hospital. It can also happen in community. But when it comes to community, that's where we look at policies. Are we talking about mental health regulation? When we talk about section 135, if you write that one down, section 135, section 136. However, on your own level, we are doing level 3 now. So that video you watch is kind of a scenario that we need to beautify to let you know if you are in that position working as a level 3, you are not particularly supposed to be in front line doing assessment. However, you are going to be working with different MDT, multidisciplinary team, where we talk about psychiatrists, maybe doctor, nurses, other senior health professionals, social workers as well. So you are not far from when we talk about those who work as a personal assistant in any hospitals. It might involve feeding. It might also involve restraining a patient. It can also involve you monitoring individual. So when you are monitoring individual, they normally call observation. They call observation. They can put it on intermittent, which is 15 minutes observation. They can put it in hourly. They can actually put it between eyesight, that you can see your patient, whatever they are doing, depending on the level of aggression or mental health issue with that individual you are looking after. So now we have someone that we introduce ourselves in a minute, because when we look at forensic community, the language forensic, people normally look at that approach to managing people who are mentally unwell. But today, we're going to kind of structure our 3 questions that you might likely come across when it comes to interview in getting the job, or as an NGO, you might have doubts of your tomorrow, or you might also say, oh, in the world around now, we have Canada, we have America, we have UK, everybody want to travel there. But this training kind of give you first line of appointments as an individual, what you want to do when you get there, either you want to get job or set up your NGO. So I would like my partner, Kathinga, to introduce herself before we continue, so that you will know what we are here to offer you. Thank you very much. Kathinga, do you want to say something? Okay, if you unmute yourself, sorry. Doctor, are you sure she's on mute?
Okay, thank you. Can you hear me, Alex?
Yes, I can hear you perfectly.
Okay, hello everyone. It's very nice to meet you virtually. I am Kirtiga. I'm currently a forensic psychology master's student in the University of Derby in United Kingdom here. I have done my bachelor's in psychology, 3 years in Malaysia, and I've just come abroad here to do forensics specifically as my master's.
Thank you very much. Right now, we have questions for you. I think I'm not sure if they will be difficult. It's from your community, because we sent out your picture, we sent out your background, your biography. We also sent out a YouTube of mental health assessments. So this kind of come together for them to cover their simulation practice. You have level 3 mental health student here. They are under the Plage Metaverse in Nigeria. Although Le Plage Metaverse cover over 10, 15 countries, if I'm sure. And in partnership with OFC College, it cover, I think, over 5,000 individual facilitators and their community. So right now we are still partnering in order for us to provide evidence-based education. That's why we are here. Firstly, can you let us know, when we talk about forensic mental health or forensic in police office, in forensic in government organization or local government, what do we exactly mean? What are we going to be looking at when we talk about forensic?
Okay, so basically, when you look at psychology first, psychology look at mental health. Anybody can be your neighbors, your teacher, your friends, anybody who has been diagnosed with a mental health or someone who experienced symptoms. But when you look at forensic psychology specifically, you're looking at criminals, you're looking at offenders, somebody who have went to prison or somebody who have committed a robbery. Why do they do that? Why did they go to prison? What is their story? What kind of mental illness did they have? Does that affect them to be a criminal? Did that have a relationship? So as a forensic psychologist, we look at criminals and their behavior, their actions, their mindset.
Wow, thank you very much. I think that was straightforward. I'm happy you said this. I'm happy that this is being recorded, if I'm right, doctor. Please, we want to listen to this again. It's very important. Again, let's look at the other way around. We have people who are working in hospitals now. We have people who are working in nursing home, maybe in Africa. We also have community health promotion that under, is it World Health Organization or African Union? What is your education when it comes to connecting to hospital? Is it like everyone in hospital or just particular people who are mentally unwell?
You mean somebody who can work in the field?
In the field, which part, which department, how can they, what are the relationships? Why is it important, this forensic?
Okay. So when you look at why forensic psychologist is important in hospital or healthcare facility is because firstly, you need to understand the person. Why did they commit the crime? What were their motives? So when, as a forensic psychologist, you will do some assessments. You will make risk assessments. So you sit down with the person, you try to understand what happened in the past. Were they having drug problems? Were they diagnosed with depression? So when you have a risk assessment with this person, and then you will assess, will they be likely to commit a crime again? If they come out from the healthcare facility, when they go back to the community, are they safe to them and to people around them? So having a forensic psychologist in healthcare allow the general public, allow the people, the victim in itself to feel safe because you try to understand the criminals, why they did that, and is it safe for them to be released out their back?
All right. Okay, in your own experience as community intervention lead, you've led when it comes to being a president of your own community. Maybe you can measure it yourself. What is our expectation now as an NGO? Maybe someone here now thinking, what am I going to do? How can I fit in as an NGO organization?
Yep. So as a student, we because that's the lowest we are starting. As a student, you can be thinking, what can I do to the community? What can I do as an NGO? I tell you that there's a lot of things that you can do, even as a student, even as a level 3 student. For example, when I was studying back in my university, I created with my friend, Siu, not to mention her, we created the Club for Mental Health. So basically, there's so many things you can do. For example, you can volunteer. You can have talks, you can support victims, you can have a conference on yourself, you can educate your friends, your public, you can have activities with victims, like for example, have a special meeting, talk to them, have an emotional support. If you have further qualification, for example, if you have a degree in psychology, if you have a master's in psychology, you can give out free counseling, support them emotionally as well.
Oh, thank you very much. I think that was the tech question I was supposed to ask. You've already put them together. The last bit of it, on level 3 now, is a kind of evidence-based training we have in now. If we complete this training in mental health level 3, what is your advice for us to move on? Or maybe in education or job-wise, what is your advice for us?
Okay, with level 3, there's a lot you can do. Firstly, I suggest and I would really recommend for everyone in this class to volunteer. You can volunteer in mental health clinics or as a organization, non-profit organization, or you can volunteer in specifically prisons or they have some kind of talks where you can volunteer. Apart from that, if you want to give out more, you can provide financially, you can support them. Or apart from that, you can create awareness from your house. You can volunteer from your house, put out information, send out information to other people on your social media, Instagram, Facebook. You can do so many. And if you want to do education-wise, then you can take up more courses after level 3. You can get a degree and so on and so forth. But I would say the first step is to always volunteer. You learn a lot. That is your first step, I would say, to volunteer.
I think we need to do a different program so that we just talk about the importance of volunteer. Because in this community, when we talk about volunteer, people are like, how can I just, like me, I did a voluntary job for 5 years. So it makes sense to me what you are saying. But a lot of people who actually need money or who are in a community that when we talk about developing world, the first language I want to hear is that how can I travel out to this country? So I'll go and make more money. Or how can I get freedom from this crisis community? And that's the first thing on their head. But I'm not saying everyone is like that, but the fact that we need to create a special program, we'll speak to doctor to organize that so we can talk about just volunteer, the importance of volunteer. Yes, it's recommended, 100% agree with you. Last, I don't know if doctor want to ask any question or if you have any advice.
Are we waiting for doctor?
Yeah.
Okay. Thank you, Mr. Alex, and thank you, Kitiga Matiyalanga. We've made appreciable progress. Just like we earlier stated, we had some technical issues which couldn't make us do our usual 1,000 capacity Zoom, but we are going to be recording this, and as usual, we'll be having a short break, maybe just 5 minutes. We use the same link to reconnect back, and once we reconnect back, we'll continue. But this is going to be recorded. Once we come back, the next session will be recorded, and that's just that. Yeah, thank you.
Now you have questions, right, for us to set up?
Yes, when we come back in the next few minutes, we'll ask the questions. We have 3 more minutes to go. Yeah.
Excellent, excellent. Thank you very much. Katinga, do you agree with that? We're going to come back in 5 minutes.
Yeah.
So we can have our tea break.
Thank you.
In UK, we call it tea break.
Yeah. Okay.
All right. I'll see you guys soon. Thank you.
Okay. Thank you very much. Please, we just use we use the same link to reconnect back. But for everybody that is here and those people in the class, this is going to be sent to the class immediately so that everybody can follow up the recorded version. Thank you.
Yeah.
Yeah.